I think the work that is being done by AAKP is so critical to patients all around the country. Their ability to advocate on our behalf ensures that everybody understands the impact of kidney disease and what they can do to help us.
Now everybody is fully understanding that to achieve a better quality of life, you really need to listen and take into consideration what the patient views as a better quality of life for them.
I always have fun at an AAKP event. How could you not have fun? You're with people who understand completely what you and your family are going through. So it's not just for patients, AAKP. AAKP should be for the family of patients, because when a patient has kidney disease, the family has kidney disease.
Belonging to an independent advocacy organization like AAKP gives me the confidence that I can represent them and people living with kidney disease to represent them honestly.
Our objective over the coming decade is to reach people around the globe and not just limit it to the United States, because kidney disease is a universal disease.
They encourage patients to be the voice for their care and treatment. And I don't see that as much in other organizations. And I feel like that is so necessary for patients to feel like they have a voice and they can make change in regards to their care and treatment.
I think the AAKP, by being a patient-oriented group, impacts not only the medical devices, but pharmaceuticals and pretty much anything that's to do with the patients, because those companies will respond more to a patient than they will to a doctor, I think.
It's important to be a patient advocate because to whom much is given, much is required. I was given this gift of life back in 2008 by my donor, Leanne, rest in peace. She was a deceased donor. So now, if I can use my voice and use my platform and influence to impact lives, and my favorite word, why not? And why not become an organ and tissue donor today?
We spend a lot of time here, particularly in DC, in the nation's capital, talking with staff, with the legislators, and trying to help them understand exactly what the patient perspective is on anything that's kidney or renal related. It's a great honor to be able to do it. Our numbers are growing, and part of our strategy is for them to understand that we will come and visit and talk with them, and we represent the patient voice, and we want that to be heard, and that's how we do it.
People around the world who are sick and suffering with kidney disease need a voice of optimism. They need the tactics, and they need the reinforcement from fellow patients here in the U.S. to do what they do and demand a change in the status quo. And we fully intend to arm patients around the world with the tools they need to be more vocal with their governments, regardless of the ideology of their government, and to demand solutions and to defend private sector companies and investors who are willing to get into this space and deliver more innovation for patients.
AAKP opens the door so that it broadens the whole horizon. You're one person. When you belong to AAKP, you suddenly become a tribe.
Welcome to Breaking News, Healthline webinar from the American Association of Kidney Patients, Coronavirus and Kidney Patients, a CDC expert webinar hosted by AAKP's Center for Patient Education and Research. Thank you for joining us today for important information regarding the coronavirus, or COVID-19, and kidney disease from AAKP's trusted federal partner, the Centers for Disease Control and Prevention, the CDC. AAKP is proud to have the CDC as one of our long-term federal strategic partners, and AAKP is honored to serve as an ex officio member of the CDC Health Infection Control Practices Advisory Panel. My name is Erin Kale, and I am Director of Stakeholder Operations for AAKP. I oversee our patient education and grassroots engagement activities, including our Ambassador Initiative, which comprises highly motivated and engaged patients and caregivers around the country and the globe. These individuals have a direct connection to kidney disease and wish to raise awareness and provide support to others navigating the challenges of this chronic disease. AAKP's Healthline webinars fall under our Center for Patient Research and Education. We believe patient and caregiver education is an integral part of treatment and protection of patient lives, and we work to ensure that the patient has a central role in research and guidance that are designed to determine optimal approaches and strategies for providing healthcare services, assistance programs, and access to new products and services. This is especially true during national emergencies such as the coronavirus pandemic. At this time, I'd like to introduce AAKP's President, Richard Knight. Richard is a former in-center hemodialysis patient who received a kidney transplant over 12 years ago. Richard?
Thank you, Erin. First, I would like to thank everyone who has shown a concern for kidney patients and the threat of COVID-19 and who joined this call today on short notice. Secondly, I want to thank CDC for their time and expertise on the call today and for their expert guidance to AAKP over the past month. AAKP is proud to have CDC as one of our long-term federal strategic partners, and we're in fact honored to serve as a member of the CDC Health Infection Control Practices Advisory Panel, HIPAC. Based on our federal relationships, we will be conducting other expert webinars in the weeks and months ahead for patients and their families. We have arranged and hosted this call today because AAKP for 50 years has served as an independent voice of patients, and we take our role in educating patients and providing insights into their concerns to policy leaders very seriously. The COVID-19 is serious. It's a serious threat to all Americans, especially those with underlying health conditions and those of us who are immunosuppressed, like all of the kidney patients, many of you listening out there today. I know this threat as well. I am a kidney transplant recipient who has been self-quarantined on the advice of my medical team for the past 12 days. I was recently exposed to a person with a confirmed case of COVID-19. I pray that everyone who is there and who may face the threat of this disease, I pray that they're safe. Many of those who have registered for this call have sent in great questions for the CDC, which the CDC will answer at the end of their presentation. I'm asking all who are listening to stay connected to AAKP and to share your involvement in our online efforts. Because although our reach has grown, we believe we need to educate more patients. We need to educate more patients on how serious this virus is and the threat that they face. I will now ask my fellow transplant recipient and AAKP Chair of Policy and Global Affairs, Paul Conway, to talk about a survey research that led in part to the call today with CDC. Paul serves as AAKP liaison to the CDC HIPAC committee. Paul?
Thanks, Richard, and thanks, Erin, and thanks to the CDC for the time today. As Richard mentioned, AAKP has significant resources for doing survey research and flash surveys. And several weeks ago, we did a survey among kidney patients on social media and also through our other communications platforms to find out whether or not kidney patients were in fact concerned about the coronavirus. Sounds simple? The answer was rather interesting. 78% selected yes. But to go a little bit deeper, we wanted to know, for those patients, how many had actually been communicated with by their facility or by a medical professional on their transplant team or one of their general practitioners. 84% told us no, only 12% told us yes. We became quite concerned with this and reached out to CDC because we thought that as an authoritative voice in this field of public health, we could get some quick and expert advice from the CDC. By the way, in asking our questions, of the most credible source. Patients view the CDC by far as the most credible source, given 8 or 9 other sources to choose from, including the media or the internet. For those who are listening, you'll see updates from time to time from AAKP and invitations to participate in our flash surveys. We strongly encourage you to participate because the insights from those surveys are provided by AAKP to various federal agencies and to the Congress, so they can have a pulse instantly on what kidney patients are concerned about, what they're fearing, and policy alternatives that they would like to see considered. Thanks, Richard. I'll turn this back to you, Erin.
Thank you so much, Paul. I'd now like to introduce our special guest speaker from the Centers for Disease Control and Prevention, Dr. Shannon Novosad. Dr. Novosad is a medical officer with the dialysis safety team in the Division of Healthcare Quality Promotion, Centers for Disease Control and Prevention. Dr. Novosad received her medical degree from the University of Alabama at Birmingham. In 2015, she came to the CDC as an epidemic intelligence service officer assigned to DHQP, where she investigated outbreaks in healthcare settings. Her areas of concentration include prevention of central line-associated bloodstream infections and increasing the safety of patients on dialysis. Dr. Novosad, thank you so much for taking time out of what must be a very hectic time for you and for joining us today. I'll now turn things over to you.
Thanks so much, Erin. I'm really happy to be able to speak with you all today and to be able to get some information out to patients who I know are, eager for information and to learn about ways they can protect both themselves and their families. All right, so just to go through a few of the things I'm going to talk about today, I'm going to briefly describe what COVID-19 is, including, why we call it COVID-19. That part of the presentation will be relatively brief, but I did want to make sure that you had some background information. Next, we're going to go through what patients can do to protect themselves from respiratory infections, included COVID-19. A lot of the things that are good practices to prevent general respiratory infections such as the flu are also very effective at preventing COVID-19. And then we're also going to detail CDC's recommendations for outpatient hemodialysis facilities, just really to give patients an idea of some of the changes they might start seeing in their facilities. And I will expand a little bit on these recommendations and so that you could see how they might also affect just a general outpatient clinic as well. So what is COVID-19? So first, just I think starting with the name, why do we call it COVID-19? It is really an abbreviation for the name Coronavirus Disease 2019. The CO stands for Corona, the VI for virus, D for disease, 19 refers to 2019. So you might hear this called a lot of things in the news. You might hear COVID-19, you might hear a novel coronavirus, you might hear SARS-CoV-2. But just in general, different names, but kind of all referring to the same thing. So what is it? It is a respiratory illness and caused by a type of virus called a coronavirus. Coronaviruses are actually a group of viruses named for the crown-like spikes on their surfaces. So corona, for crown. And you might have even had a coronavirus in the past. There are some that, are common in people, cause, like a similar syndrome to the common cold. But there are other coronaviruses that primarily infect animals. However, we've learned over time that these can evolve and actually make people sick. So in the past, you may have heard of, SARS-CoV or MERS-CoV. So that's a similar situation here to what we think happened in that case, in terms of, infecting an animal, evolving, and then being able to infect people and make them sick. And so this one was a new coronavirus, meaning it wasn't previously identified. It was first discovered in China, really only over the past few months. And just to think kind of back through how we how much has happened over such a short period of time. It's was really only first started to hear about it, maybe even in January. And then by January 31st, 2020, the Health and Human Services Secretary, Azar, declared it a public health emergency for the United States. And so how does it spread? We think it's primarily spread from person to person via droplets that can land in the mouths or noses of people who are nearby or possibly be inhaled to the lungs. This typically occurs through people that are in pretty close contact with one another. We think that occurs at about 6 feet is, kind of the distance that these droplets can travel. So when you hear some of the recommendations, particularly for healthcare settings, and discusses, keeping patients 6 feet away from one another, that's where that recommendation comes from. And the respiratory droplets are released when an infected person, coughs or sneezes. It may be possible that a person could get COVID-19 by touching a surface or object that has a virus on it, and then touching their own mouth, nose, or possibly their eyes. But that's not thought to be the main way that the virus spreads. However, since it's possible, a lot of the recommendations that you'll hear about also kind of stem from this mechanism of spreads, such as hand hygiene and disinfection. And notably, the virus, that causes COVID-19 does seem to be spreading easily and sustainably in the community. So when you hear community spread, that's what that means, and particularly worse in some affected geographic areas. And so this means that people may have been infected with the virus in an area, including some who are not sure or how or where they became infected. But we still think that the primary mechanism that they became infected was the two that I discussed. So either the person to person, through respiratory droplets, or coming into contact with an infected surface or object. And so the signs and symptoms of COVID-19, we think it takes about 2 to 14 days for the symptoms to start after a person has been exposed. You might read that there's a median of 4 days. So we think 4 days is probably around, kind of the most common amount of time the symptoms develop, but really anywhere from 2 to 14 days is when it can happen. Some of the more common symptoms are fever, cough, sore throat, shortness of breath, muscle aches, and fatigue. But we've also started to hear of some less common symptoms, including, headache, gastrointestinal symptoms such as diarrhea. And importantly, the initial symptoms might be mild and fever might be absent in some groups of patients. And this is something we're still really learning a lot about, what COVID-19 might look like in specific groups of patients. So for example, what does COVID-19 look like in a transplant patient versus a patient that's on dialysis? Some of these signs and symptoms may be the same, but it may look, different depending on kind of your level of immunosuppression and such. And who's at risk for getting very sick from COVID-19? We do know that some people are at higher risk of getting sick. For example, we've started to learn more about what COVID-19 means for folks who are older. And we have seen both in the United States and in China that the risk of serious disease and death increases with age. There was a report that was just published looking at severe outcomes, and they found that a majority of deaths occurred among older individuals. Specifically, 80% of deaths occurred among adults that were greater than or equal to 65 years old, with the highest percentage of severe outcomes among those aged greater than or equal to 85 years old. And this was all data out of the United States. And this was really similar to reports that have come out of China, which indicated more than 80% of deaths occurred in individuals that are greater than or equal to 60 years old. In addition, there's groups with certain medical conditions like serious heart disease, diabetes, chronic lung diseases such as moderate to severe asthma, those who are immunocompromised, so who are being treated for cancer, who have received, transplants such as kidney transplants, liver disease, and kidney disease in general. So we think all of these, chronic medical conditions do put a person at risk for having more severe disease. And in addition, as we add these, medical, conditions together, or add medical conditions and ages together, we may find that that increases the risk even more. And so as a kidney patient, it's really important that you take precautions to protect yourself. So we're just going to go through some of these now. And these are, I think, important to think about. These are things that you could be doing both at home and, if you were in like a healthcare facility. So might be applied slightly differently, but practices that you should be thinking about all the time. So first is hand hygiene. So hand hygiene, it sounds easy, but most of us don't really do that great a job at it, or we do it, but we don't really do it correctly. So it's really important that you wash your hands often with soap and water for at least 20 seconds. If soap and water is not available, you should use a hand sanitizer that contains at least 60% alcohol. And this is definitely not an all-inclusive list of times that you would want to, clean your hands, but some particular times you'd want to think of are, after blowing your nose, coughing or sneezing, after being in a public place. So, immediately when you get home from going out to the grocery store or somewhere else, doing hand hygiene. And when you're out in public, after touching surfaces, which unfortunately you will probably have to do everywhere you go, but just kind of thinking through your mind when you're doing that and knowing if you have a way to clean your hands after you do that. In addition, washing your hands after using the restroom and before and after eating is also very important. There's kind of a bucket that we call respiratory hygiene. This really consists of covering your cough or your sneezes with a tissue and then throwing that tissue in a trash. If a tissue is not immediately available, coughing or sneezing into your elbow. And then again, as we just mentioned, immediately cleaning your hands. And also important, it's really okay to ask people around you to follow the same proper respiratory hygiene. I mean, we're all in this together and we want to prevent, getting other people sick if we're sick, but, vice versa as well. Cleaning and disinfecting services. So it's important to clean and disinfect your home to remove germs. And this also, should be occurring, in any healthcare facilities that you're in. You should practice routine cleaning of frequently touched surfaces. So again, not an all-inclusive list, but these could include tables, doorknobs, light switches, handles, desks, toilets, faucets, sinks, and cell phones. And there are various instructions for how to clean some of these on the CDC website that you could look at. In addition, it's important that whatever you're using to clean, that you're really following the instructions. So this is also something that we tell, for folks cleaning healthcare facilities, it's really important to make sure that whatever product you're using, you're actually following the instructions. Because if you're not following the instructions, the product's really not going to work as you think it's going to work. And it probably will give you a little bit of a false sense of security in terms of how much you've been able to clean and disinfect the surfaces in your house. So, for example, you should know the amount of time that a surface must stay wet with the solution to properly disinfect the area. And also know that, if you're using a wipe, for example, you need to make sure that you aren't trying to clean too large of an area with the same wipe. So you need to make sure you're getting kind of the whole area wet as well. There's some things to avoid. You've probably heard a lot about these recently in the news as well, such as avoid touching your face, your nose, and your eyes. Again, thinking back to how we said we think this virus is transmitted. If you pick this up on a surface and then you touch your face, nose, and eyes, then you're potentially transmitting that way. You want to avoid crowds as much as possible, especially in poorly ventilated spaces. These are more closed-in settings that might have little air circulation. So if there are people in the crowd that are sick, it'll be much easier to pass back and forth. You want to avoid handling high-touch surfaces in public places. Again, some of these are things that we've already mentioned, such as the elevator buttons, the door handles, handrails, and handshaking with people. And if you're able, you could use a tissue or your sleeve to cover your hand or fingers if you must touch something. So again, we know it's not feasible that you're going to be able to avoid touching, everything when you go out in a public place. So that's why you have to take all of these practices, together and make sure that, you're doing the hand hygiene and the other, activities as often as needed. And then some other considerations. So really just taking what we call everyday precautions to keep space between yourself and others. So this, involves staying home as much as possible. One thing that a lot of people are doing now is considering ways of getting food brought to your house, either via, delivery from the grocery store or others. When you go out in public, keep away from others who are sick. You limit close contact and wash your hands often. And again, you've also probably heard a lot about this, just avoiding, cruise travel and, non-essential air travel. It's also really important to have a plan if you get sick. It's really not that much fun to think about, but it's much better to do it, when you're feeling well, your family and your caregivers are feeling well, because if you wait till you're sick, you might not be able to get all of these things in order as quickly as you would like, or you might just not be feeling well enough to tackle them all. And this really starts with talking with your family and your caregivers. So just bringing up that you need to make a plan, and you're just starting to get some ideas down on paper. Figuring out how you will stay in touch with others by phone or email if you're not able to see them in person. And just know that you may need to ask for help from your friends or family to do these things. Know important contacts and have phone numbers for your dialysis facility, your medical providers, and any care providers that you have. If you have a caregiver, it is also important to determine who can provide you with care if your caregiver becomes sick. And you need to make sure you have access to several weeks of medications and supplies. And that ranges, depending on what the medications are and your particular situation, that could be anywhere from several weeks, to 30 days of medications and supplies you want to keep on hand. It's also important to start, just making sure that you're kind of stocking up, on a couple of weeks of, healthy, kidney-friendly foods. And there is actually some information available on kind of an emergency diet plan for dialysis patients on the CASER website as well. It's called the CASER 3-day emergency diet plan for dialysis patients. And then if COVID-19 is spreading in your community, and you may know this by what you've heard from others, you may have heard about this on the news, know that there may be additional precautions recommended for you by your local public health authorities in addition to what I've discussed on the prior slides. So I think it's really important that you stay up to date on what's happening in your community, because again, there may be additional measures you need to take to keep you safe and to further reduce your risk of being exposed to this new virus. And the local public health authorities and others will have additional advice and more details on how to stay at home in your area, and information on getting food and medications delivered, that are very specific for the services available in that area. It's also important, to stay in touch with your healthcare providers. So calling your transplant center or nephrologist or primary care doctor, to find out what they want you to do to stay safe. They'll give you information on which appointments that you need to keep, which ones may, you be able to postpone, or you may interact with your healthcare providers in a different way, which I'll discuss a bit in a later slide. But importantly, really should not delay, critical, medical procedures or needs, specifically not delaying the dialysis treatment is something that, we feel is really important for patients to understand and to feel safe getting those treatments. And so if you feel sick or think you may have been exposed, calling your dialysis clinic or transplant center and primary care provider to let them know of your symptoms. This will help them take care of you and make proper preparations for your dialysis treatments and appointments. For example, if you're coming in and have symptoms, they may want to know so they can keep you separated from the other patients. But also really important to know when you need to get emergency help. Again, not an all-inclusive list, but if any of these are developing, such as difficulty breathing or shortness of breath, persistent pain or pressure in the chest, new confusion or inability to arouse, so feeling very sleepy and not able to focus, bluish lips or face. Again, if any of those, you should immediately call 911 and not just call the clinic. And so I'm going to go just a few slides over some of the CDC's recommendations for outpatient hemodialysis facilities. Again, not going into all the details, but just to kind of give you an idea of some changes you may start to see in your dialysis facility. And then I will relate these back to, some general things that you may start to see more in just outpatient clinics. And so you can, see these on our website. The web address is shown here on this slide. Again, this guidance is written, for the healthcare providers and healthcare facilities. But I think it's also important that patients know, what their facilities are being advised to do right now and what they should be thinking about. Because again, I think if you're not seeing these things happen, or you don't feel like they're happening, for all patients, or that they're, happening ineffectively, I really want to, encourage you to, speak up and see if you can find out more about what's going on in the facility. So what we're encouraging all facilities to do is really increase their education and training of both staff and patients. And some of this is, some of the stuff I mentioned already. Specific stuff we want to make sure both staff and patients are educated on include, the importance of hand hygiene, respiratory hygiene, and cough etiquette. And really, staff should not be reporting to work if they are ill. So if you see staff members, that are coughing or otherwise looking ill, you should definitely feel empowered to ask them, how they're doing, and ask them why they're at work that day, and to inquire more about that. Staff should be trained about the proper use of personal protective equipment. We also call this PPE. So this is the, extra gear you might see your providers wearing that help prevent them from getting infections and also transmitting infections, between patients. And this includes, masks, eye protection, so like goggles or specific kinds of plastic face shields, gowns, and gloves. And in addition, we want staff to know what the signs and symptoms of COVID-19 may be. So if you as a patient are, interacting with them and you express any of the symptoms, they would know right away to start thinking about whether, you need to be tested or if you may have been exposed. And also that they know how to contact the local health department for support. Again, as I mentioned earlier, in different areas of the country, there's different levels of, transmission of COVID-19. So different considerations, may apply depending on where you live. So again, if you, speak up to your facility administrators, if you haven't been educated, or if you would like to hear more about, how they're training the staff to do these things. In waiting areas, you definitely should start seeing some changes there. If you think about waiting areas, a lot of them are rather small. You might be sitting there, in very close proximity to other patients. And as we, mentioned earlier, we think one of the primary ways that COVID-19 can be spread is, through respiratory droplets between people that are in close proximity. So just thinking through waiting areas, there need to be probably a number of changes to keep them safe for all of us. So you should start seeing some signs at clinic entrances with instructions, for patients with fever or symptoms of respiratory infection, such as cough, shortness of breath, sore throat, to alert staff so that appropriate precautions can be taken. There should be space in waiting areas for ill patients to sit separated from other patients. So some places, they might designate 2 different waiting areas. Some places the waiting area might be big enough to separate patients by 6 feet. So it could just be like one side is for patients who could be having symptoms and one side for other patients. Other places actually might ask, patients to wait outside if the weather permits or facility layout permits. So this could be done in a variety of ways. There should also be in the waiting area, tissues, alcohol-based hand rub, and trash cans provided so that you can do all the things you're supposed to be doing in terms of hand hygiene, respiratory hygiene, and cough etiquette. And you may also see more signs with just general, information and education about those things as well. And so really your facility should have a plan for your arrival. So a plan to identify if you have a fever or symptoms of a respiratory infection before you enter the treatment area. And you really should be being educated and told to call ahead to report fever or respiratory symptoms, which again will allow your facility to plan ahead for your arrival in terms of having, an appropriate place for you to be treated, or if your symptoms are severe enough, directing you to the hospital. And in addition, you should be asked again about fever or respiratory symptoms when you arrive. And if you have any symptoms, you should be giving a face mask immediately, and you should wear that for the entire time you're in the facility. And then in terms of your dialysis treatment, ideally, if you're ill, your treatment's going to be in a separate room if that's available with the door closed. Some facilities have isolation rooms that they can use for this. However, if your facility does not have a second room, treatment can be done safely as long as your facility is able to maintain at least 6 feet between, you or another symptomatic patient and patients who are not symptomatic. And that really should be in all directions, so in front, behind, and side to side. And sometimes facilities are able to do this by putting patients kind of at the end of a row or a corner, just really away from the main flow of traffic. And again, this is likely to look very different across different dialysis facilities, just depending on, what the layout is in that particular facility. In terms of environmental cleaning and disinfection, the way that your facility cleans and disinfects, we think should be appropriate for COVID-19. They might have to, use a disinfectant specifically against COVID-19, but the way they, do the cleaning and disinfection should remain the same. And also, one of the other things is any surfaces, supplies, or equipment, located within 6 feet of an ill patient either need to be disinfected or discarded. So stuff, that can be disinfected should be cleaned. Stuff that can't be, for example, magazines in a waiting room or stuff like that would have to be discarded. Again, that was a pretty high-level overview of some of our guidance, but kind of based on this, these are some things that you might notice at your dialysis facility. So you might see a change in your treatment time or day. So depending on your facility setup, staff may need to change your schedule to make sure you're receiving the safest care possible. And so this would happen if, if you have symptoms or respiratory symptoms, and they're trying to figure out the safest way that you can get dialysis without exposing other patients. They may ask you to come, to a different shift where they're able to keep you more separated, or they may change people's days up. Again, this would really just depend on the facility and how they're arranging things. But again, I think just knowing that this could happen in your mind and remaining flexible. You might notice a change in your chair. Again, this just goes back to the facility needing to rearrange stations to keep patients safe. You might notice a change in the personal protective equipment or PPE that the staff wear. Again, they may be wearing additional or special gowns, more than you're used to seeing to care for you, as well as face masks during, high-risk times. And facilities may ask you to wear a face mask for your entire treatment from the time you enter the building to the time you leave. So again, speak up. Don't be afraid to use your voice. If you're not seeing these things happen, it's okay to ask staff questions, such as what is the clinic doing to prepare for COVID-19? How will these changes affect my treatment? What can I do to protect myself and others? And then, for example, if you didn't see them clean their hands or you don't think they did it appropriately, you can ask them if they would mind cleaning their hands again before you care for me. And then taking that a little farther just to outpatient facilities. Again, a lot of the same principles I described for outpatient dialysis facilities really will apply across outpatient facilities. So for example, if you need to go see your transplant doctor, your primary care doctor, your nephrologist in his office, a lot of these, similar principles will be taking place. So again, you might need to be flexible. You might find out that your appointment's going to get rescheduled or converted, to kind of a phone visit or a telehealth visit. So again, this all goes back to decreasing, the risk of you getting exposed to COVID-19. And so if it's not an urgent appointment where your provider needs to see you in person, again, they might reschedule it or, or do it over the phone or some other means. Facilities and healthcare providers may be reaching out to you to make sure you have sufficient medication refills. Particularly important, for medications such as, immunosuppressive agents and others that you really can't miss. And they will provide you instructions on how to notify the provider if you become ill. Again, you will be asked, and if you're not asked, you should just do this anyway, to call before any appointments, or procedures that haven't been rescheduled. If you have a fever or any respiratory symptoms, again, this goes to protecting others and protecting yourself in terms of getting exposed to COVID-19. You may also notice a change in the protective equipment that staff and other outpatient facilities are wearing. They may be wearing, again, gowns similar to what you're seeing in the dialysis facility, as well as face masks. And similarly, you may be asked to wear a face mask, when you arrive at the facility or for your visit until the time you leave. And so there's a number of resources on the CDC website. These change all the time and get updated pretty frequently. So this is just a list of some of the ones we thought you might be most interested in kind of keeping track of. But there at the top, it's for the cases and latest updates. So there's a number of links on this site, and it gets updated almost every day. It just gives a number of cases across the country. It breaks them down by state and also in other countries outside of the U.S. and any high level information or new information that's learned. You can kind of find all of that on that website. There's also a website about people at risk for serious illness from COVID-19, and this also gets updated pretty frequently, and in fact was just updated recently as we kind of learned more information. We added more details regarding what conditions are thought of as chronic medical conditions that might put patients at higher risk. So the part about kidney disease was added recently, I think sometime last week. So again, I think keeping an eye on this webpage, knowing what groups are thought to be at higher risk, and then any new methods for decreasing risk in these groups could be on this page. About preventing COVID-19 spread in the community. So again, a lot of good information about what you can do at home or in your community to prevent spread. There's some videos as well, which contain just general information on COVID-19, but some more information on ways to keep yourself safe. And then there's a number of print resources, so fact sheets and stuff that have a lot of the similar information that I presented earlier. But I think importantly, just knowing that this is an emerging and rapidly evolving situation, and that we'll provide updated information as it becomes available. Through various communication means such as this, and updating the guidance on the website. So that's all the slides I have. I'm happy to take some questions now and turn it back to Erin.
Thank you so much, Dr. Novosad. This is really important information, and again, we appreciate you being with us today to share this with our audience. So we do have a number of questions that have been coming in, and I'll try to organize these by the type of patient or the type of treatment that they're undergoing, just to kind of keep things together. So one of the questions is from Mike. He is asking if he's infected with coronavirus, and he's a transplant recipient, would the immunosuppressant drugs that he's on need to be stopped or lowered in order to effectively treat coronavirus?
Yeah, that's a good question. And I think it really depends on exactly what immunosuppressive drugs that he's on and kind of where he's at, I think, in his transplant state. So I think that's why it's really important for all patients, to know exactly how they can get in touch with their providers and how they can get more information. Because I think in a situation like that, it would really have to be tailored, to the specific patient, and again, kind of where they're at in their transplant trajectory and exactly which medications they were on, how they would want to alter the levels of those medicines, and then how they would want to keep an eye on that as well. So I think, yeah, definitely making sure that you have ready, phone numbers and easy ways to get in touch with your physicians, so that if you're worried you've been exposed or infected, you can make a plan immediately in terms of what you need to do with your other medications, such as your immunosuppressive meds.
Great, thank you. And similarly, Mary is asking what the risk of losing her transplanted kidney is if she is infected with COVID-19.
Yeah, so I think as I mentioned probably on the very last slide, COVID-19 is, even though we hear a lot about it in the news and it's hard to believe this, it's, we've really only very recently even knew that this existed. So it's just been a few months now. So we're still learning so much about, specific risks, such as the risk to a transplanted organ and such. So I will say, as of today, I don't know that if any particular increased risk just, from having COVID-19 itself. I think it all goes back to, how, sick a particular person gets when they get COVID-19 and what, ramifications that could have in general just for, organ dysfunction. So some people who get COVID-19, get very sick and, develop kind of the syndrome known as sepsis, which can lead to organ dysfunction. So again, I think it's one we don't know the answer to, but why I think it's really important that any patients that we think are, at particularly high risk for getting severe disease, such as transplant patients, need to take all the precautions that they can, to prevent getting exposed.
Great, thank you. And Patty was asking if, who she should contact first if she has any symptoms. And this is for any person affected by kidney disease, not just dialysis or transplant. But should she contact her primary care doctor first or her nephrologist, or should she contact them both?
I think patients should contact them both. I mean, I think for every patient, it's a little bit different again, who's kind of their primary medical person. So, I mean, I do know that for some patients, a nephrologist or others, may act more as a primary care doctor. So that's why I don't want to give an answer just the nephrologist or just the primary care doctor. I really think, it's important that both being kind of notified immediately, so that they can, make appropriate plans. If, for example, a patient is like imminently on their way to dialysis, like they're supposed to leave in the next hour, maybe prioritizing then to call the dialysis facility and see how they want to handle it. But in general, I would advocate for notifying both.
Okay, thank you. We have a number of questions coming in from dialysis patients. Brianna wants to know where dialysis units will plan to run those patients who are tested positive with the virus.
Yeah, so that'll be very different for different dialysis facilities. We do know, scattered across the country now, we've started to find, dialysis patients who've been infected with COVID-19, and they are being dialyzed in a number of areas. Many of them were very sick and had to go to the hospital initially just because of their other symptoms, and so we're getting dialysis there. Others who, had more mild disease are actually able to get dialyzed in their outpatient dialysis facilities. And facilities are doing that in different areas. Some are using isolation rooms. Some are designating kind of certain areas of the unit for the patients to go to so that they're separated from the other patients. But what we have really tried to work with dialysis facilities to do is to, develop ways that, patients, once they're, stable from other means, including, like the respiratory status, they're able to breathe okay, and they're not requiring, oxygen and that kind of stuff, and they're ready to not be in the hospital anymore, that they can, find a way to safely go back to their outpatient dialysis facility. So again, it can look a little bit different depending on your facility, but those are some of the ways they might do it. And in areas, where there are a lot of cases, areas of the country, such as New York and others, where there's a, much wider spread transmission, some units may be designating particular shifts in the dialysis unit. So for example, the last shift of the day. So again, your shift may get moved. So maybe you were on first shift and now you're going into third shift. But again, hopefully we're all able to do that, back at your dialysis facility. The other thing I'll mention along those lines, just in case you hear anything about it on the news or at your dialysis facility, is that there are investigating whether it's possible to designate whole dialysis units for the care of COVID-19 patients. And again, that's all just in planning, to be used in areas if there were a lot of patients. So I think just staying in touch with your dialysis facility and hearing about what their plans are can give you an idea of what you might expect to see at your particular facility.
Thank you. Along those lines, Angela is asking if her city or her community decides to go under quarantine and kind of shut down. Does she have to do her dialysis, and would facilities close?
Yeah, so that's a really great question, and one we want patients to know is that even if certain, communities, were under stay-at-home orders or had, movement restrictions, dialysis is something that you really can't miss, and we don't want patients missing their dialysis sessions because of this. And so dialysis facilities know this, and they're, making plans on ways to get you your dialysis safely. So I don't want patients to kind of equate the, if an area is under quarantine or you're being told to stay at home or limit movements, that should mean that you shouldn't go to your dialysis facility. So you should definitely still be going to dialysis. And I think it just making sure everyone's in communication. So the facility, if you have any transportation that brings you and everything, just kind of making sure everyone's on the same page. But again, those kind of orders should not limit you from getting your dialysis.
Great, thank you. And I know you mentioned this during the presentation, but if you could address this again. Terry has asked or mentioned that some of the patients that she's speaking with have reported that at their dialysis centers, one thing like hand sanitizer is mandatory, but using masks has not been mandatory. How should patients address their concerns, and to whom should they be speaking, regarding the lack of this PPE?
Yeah, that's a great question. And I think just so and different facilities may have different rules in regards to who needs to be wearing masks and stuff. I mean, we definitely say that all patients with symptoms need to be wearing masks, and any healthcare providers that are taking care of those patients with symptoms need to be wearing masks. But some facilities, might not have all of the other patients wearing masks. It just depends on, what's going on in the community, and, if they feel like they need to have all the patients wearing masks. So I think that's something to ask your facility about. If you are wondering why people are wearing the mask or why they aren't wearing the mask, I would reach out to, your dialysis tech or the nurse and ask them. And if I feel like if you're not getting the information you need from them, then I think you can, just take it up higher at the facility with the administrators and stuff. But I think, and for the most part, you'll get some really good information and I think clarity on why certain things are being done or not being done at your facility by just talking to the frontline staff. And I mean, I really think we're all in this together, a team working on this together. And, the healthcare providers want to keep you safe. They want to keep each other safe the same way you want to keep your fellow patients safe. Encouraging, any staff who see patients, for example, not washing their hands or covering their cough, to also speak up too.
Great, thank you. An additional question about being on the transplant wait list. So Sharon needs to send her blood specimen in for the month. Is it safe for her to go to a lab to have her blood drawn?
Yeah, I think that just goes back to how, we do want to limit, contact with, any healthcare facilities or hospitals if it's not, really necessary, just to prevent, exposure to COVID-19. But at the same time, just as with dialysis, there's certain things that need to happen to keep you safe and healthy. Otherwise, we don't want, all of the other, chronic medical conditions to go untreated or uncontrolled. So I think that's in those situations, that's why it's great to just kind of proactively get in touch with your healthcare provider and kind of plan for those situations. So, just saying, I'm due for my labs next week, what's the best way for me to do that? And just kind of think through that with them. They may, for example, want you to come at a different time. They may stagger patients coming in to get their blood draws. They may have just other means to get kind of some of the necessary procedures done. and kind of have a, perhaps even want you to check in before you come just to make sure you don't have any symptoms. So again, I definitely want people to know they shouldn't delay, stuff that's critical for their care. There just may need to be a little bit more planning on how to get it done safely.
Great, thank you. And for patients that have that are doing home hemodialysis or home peritoneal dialysis, are there any specific precautions or preparations that they should be aware of?
I think for home patients, I think one, critical thing for them is just realizing that they, are in these high risk groups. They have, chronic kidney disease, they're on dialysis. Sometimes I think, because they're doing so much at home and they don't have maybe as much interaction with the clinic, they may not get, all of the messages that all of the other patients are getting in terms of risk and things they need to do to keep themselves safe. But, all of the stuff, that I said earlier in the presentation about, staying home as much as possible, staying away from crowds and such, I think they need to be adhering to all that very closely. And then making sure that they're going to have all the supplies they need. So just touching base with their clinics or providers, just to make sure that there aren't any perceived issues, with supply chains or anything like that. For example, that they're going to keep getting their peritoneal dialysis fluid and tubing and other stuff they need scheduled as they need scheduled on a regular basis. And then also just knowing that, some of the ways they're getting care now may change. They may not be asked to come into the clinic as frequently. They may, get some stuff done via remotely or through telehealth. So just kind of staying in touch with their clinic and knowing when things might change. And again, as I said, for all of these other care situations, that if they are going to their clinic and they're having any symptoms, just to call ahead so that their providers can tell them what they want them to do.
Great, thank you. As you know, we also have a lot of living donors, individuals who have one kidney who are members of AAKP and who reach out to us with questions and concerns. So David reached out. He's a living kidney donor, so he has one functioning kidney. He's wondering if he's at higher risk for COVID-19 due to having only the one kidney.
Yeah, so that's a good question. I think as of now, just because we're still learning so much about COVID-19 and analyzing the different kinds of patients who've gotten sick and how sick they've gotten, we don't have any evidence that, the one kidney necessarily puts you at higher risk of getting an infection or anything. And I will say that it's probably not going to necessarily make it onto a list of what people consider high risk patients. But I mean, in my mind, I would say that, should treat yourself as one of the people who could be in these higher risk groups in terms of being, as careful as you can with all the precautions, really just to prevent yourself from getting exposed.
Great, thank you. And one final question for you before we wrap up this really informational, wonderful webinar. And if you could just repeat this, where can patients go to find the most up-to-date information on COVID-19?
Yeah, so we have a lot of information on our CDC website, more information than I can possibly go through. So if you were looking on our website, you're probably going to find stuff that I didn't even know what was there. But it's information ranging from, just how many cases are occurring, how much testing is happening, different ways to keep yourself safe, learning what your healthcare facilities need to be doing, and just really a variety of information that you could find there. So I would say go there first, and there's also, information on there on if you're not finding what you need, numbers for hotlines and other people that you can reach out to try to find that out.
Great, thank you so much, Dr. Novosad. This has been a really great and informational webinar. We appreciate you answering all of these questions. For those of you who are listening, if you have a question that we did not get to today, you can reach out to us at info@aakp.org, and we will work with Dr. Novosad to provide a response. I would like to go ahead and close with a few slides about some additional resources and services that may be of interest to you. If you are not already a member of AAKP, we encourage you to join. We offer free membership to patients and their family members, as well as living kidney donors. You can join online or by calling us. And to receive all the benefits of membership, please be sure to include your email address when signing up. You will be notified by email when opportunities arise where your opinions and experiences are needed to help inform innovation, advance care, and make a meaningful impact to improve lives. We also encourage you to respond to our flash surveys and other engagement opportunities to help us elevate the patient voice and change the status quo for kidney disease care. You can also select to receive any of our 5 different electronic newsletters and subscribe to our print magazine, AAKP Renal Life. We also invite you to follow us on our blog and social media for all the latest news and announcements. AAKP is dedicated to helping patients understand their condition and take control of their health care. We are proud to offer a variety of resources for both patients and caregivers. By visiting our website at aakp.org, you can click on the AAKP store button at the top of the homepage, where you can find a variety of educational brochures that you can order, and you can also download brochures and other resources as well. You can also call us by phone to receive materials in the mail. AAKP holds a number of events throughout the year, and these events are live streamed and recorded. We invite you to visit our YouTube channel to watch presentations from our Global Innovation Summit with George Washington University, our annual policy summit, and our national patient meeting. I'd like to remind everyone that this webinar has been recorded and will be archived online along with the presentation slides. Again, thank you so much to today's speaker, Dr. Shannon Novosad from the CDC, for sharing with us the most up-to-date information on COVID-19 and how patients and family members can protect themselves. If you have any additional questions about what you heard on today's webinar, please send them to info@aakp.org, and we will work to respond to your questions. Thank you again for joining us today. Be informed and please stay safe.